It's a very good afternoon. We're broadcasting live from our ZTN studios here in Harare, Zimbabwe's capital. My name is Munasha Mkahlera, and welcome to this special program brought to you by Zimpaper Television Network in partnership with the United Nations Development Program, with technical support from the United Nations Partnership on the Rights of Persons with Disabilities. Now, today's discussion is in alignment with this year's theme of the International Day of Persons with Disabilities. The theme being Building Back Better towards a disability inclusive, accessible and sustainable post-COVID-19 world. In recent years, UNDP Zimbabwe has joined the rest of the world in convening several discussions, awareness campaigns and dissemination of key messages around disability rights and concerns. Our panel today, we have a panel of guests joining us in studio today and a panel of guests joining us virtually. So in studio, we have Advocate Abraham Mateta, Dr. Amos Mtetwa, and Natasha Mtemeri. Those are the ones that are in us in studio today. And virtually, we're joined by Senator Rejoice Timire, Soneni Gwizi, and Ngobani Dube. As we all know, the COVID-19 pandemic has disproportionately affected persons with disabilities in Zimbabwe and across the world. There's recognition both nationally and globally that the COVID-19 pandemic and the subsequent lockdown measures put in place by governments around the world have presented unique challenges and compounded already existing risks faced by people with disabilities. Now, to start with the program today, I'm going to ask our guests, what are some of the challenges being faced by persons with disabilities during COVID-19? Can we learn from these and do better post-COVID? I'll ask Advocate Mateta to respond first.
Thank you very much. Good afternoon, viewers. I think, as you rightly introduced the program, COVID-19 came as something that was quite new in how we conceptualize disease control and prevention. And for persons with disabilities, I think the challenges mainly have to do with the disruption of livelihoods, since most of them are into informal trading and some in extreme circumstances into begging. We also think in terms of issues of social distance. Many people with disabilities have challenges with really managing to observe the social distancing rules. And we also have challenges to do with access to information. So those are the three that I would want to talk about and say we can indeed work around this and learn from them, particularly in coming up with a response post-COVID. We can increase how information is accessed. We can also increase the availability of sanitizers and other things to persons with disabilities, and we can also improve our social protection mechanisms.
Thank you very much. I'll also ask one of our virtual guests to also just touch on the matter briefly. Soneni Gwizi, what can you say are the challenges that persons with disabilities have faced during the COVID-19 pandemic?
Thank you so much for inviting me to the program. And I would just add to what Mr. Abraham Mateta has said, but focus more on women, is that women with disabilities were affected largely during COVID-19. That is access to maternal health issues, information, the right information about COVID-19, how to protect yourself as a woman. And also women play quite a big role in our homes, and so do women with disabilities. So you find out that most women with disabilities were left triple or double with disabilities where they were not able to function properly because of the measures that Mr. Abraham also put there. So not having access to your sanitary pads, not having access to family planning tablets because some women could not get into town. Transport was an issue. You had to have letters to say why you are going into town, and that's a private matter, and no one does not need to know exactly why you are going to get those things. So my concern is like women with disabilities were largely affected during COVID-19, and it's still going on. Maybe I'll stop there for now.
Thank you very much. Thank you. I'll address it to you, Natasha. As an advocate, we've heard that there are so many challenges. How have you been dealing with this during the COVID pandemic? Have you been having people coming and saying, this is what we're going through? What has been the situation on the ground?
Thank you, Manashe, and thank you for inviting me to this show. Yes, there have been many challenges, and people have been coming forward talking about what they've been facing. And some of the challenges were, as Soneni said, transport, and I'll add on the challenge of PPE, having enough things to use. As you know, people with disabilities, some rely on using mobility aids, and you need to sanitize your hands and sanitize your aids as well. So they needed to have more PPE than others with that in mind. So there was that problem of not having enough sanitizers and PPE in that regard.
Okay, thank you very much. We've identified the challenges. Now, as we move on, I'll probably just direct this to Ngobani Dube, who's also joining us virtually. What are some of the global policies for shaping a disability-inclusive and accessible post-COVID-19 world? Just as a pointer, Ngobani Dube is a fellow with the World Blind Union, so definitely we can get some global perspectives with what the situation is like. Ngobani?
Okay, thank you once again, Nashe, for inviting me, and good afternoon, viewers. So at a global level, I will obviously start from the United Nations Convention on the Rights of Persons with Disabilities, which clearly spells out the rights particularly for persons with disabilities. It does not get rights, but promotes and protects those rights. So particularly when looking at this COVID-19 issue that has affected many areas, be it education, where we saw children and other students with disabilities failing to access education, and that is also dealt with within the convention, but particularly Article 11 of the UNCRPD deals with issues of persons with disabilities in situations of risk, such as this time that we are in. But also there are other frameworks, such as the Sendai framework for disaster risk reduction of 2015, that also seeks to particularly enhance the inclusion of persons with disabilities when we deal with disasters and such emergencies.
Thank you very much.
And if you also look through the SDGs as well, the Sustainable Development Goals, they also now talk about disability inclusion with the recurring, the dominant theme of leaving no one behind, which is also critical at this point in time.
Thank you very much, Ngobani.
For now,
unfortunately,
I think
I'll have to cut you off
with
there.
those three, but there are so
Yes,
many.
most definitely. I'll direct my next question to Senator Timire. From a national perspective, what are the disability inclusive policies in Zimbabwe, and do you think they are sufficient for us to usher into a post-COVID society? Senator?
In Zimbabwe, when we look at it, we see that when COVID-19 started, there was nothing to protect persons with disability. Even in the task force, there was nothing. And then now, we, as persons with disability, don't have a policy, but we are happy now that the policy is now at the advanced stage. It's now at the advanced stage, where we know that in the policy there are some components of disaster management. But however, we still have the biggest gap to address issues of disability when disaster strikes, because we don't even have a database. So if you want to assist the people, we should know how many are they, where are they, and what are their needs. So that needs to be in place before we say anything else. And the other thing is that when people are talking about issues of disability, any issue of anything which to protect people, they should always put a disability component. But we are happy that even our disability bill is now at an advanced stage. I think if those two documents come into play and they be implemented, I think the government will be able also to address disability issues, and because they will be in the policy and also in the disability bill.
Thank you very much, Senator. Thank you so much. Now we bring it back to the studio. Dr. Mthethwa, in light of challenges in accessing information, the physical space by persons with disabilities, what can be done to ensure we address this effectively? Meaning, she also highlighted that we don't have a database that highlights who's who, what's going on where. So how do you think we can come together? What should we do to put this in place? Because it's not just about the database, but we also want people to have access to information. What's your take on that?
Thank you very much, viewers. May I just hasten to say that access to information is too broad, an issue for persons with disabilities. Mm-hmm. And Ngobani Dube has made allusions to issues around, even education. We saw the advent of e-learning, where persons with disabilities use specialized facilities only accessible, and available at the schools, most of which are special schools for that matter. There has also been allusions to the problems associated with PPE, much of which was not compatible to the specific needs of or peculiar needs of persons with specific disabilities, such as the deaf and those with albinism, your PPE, your sanitizers and your masks that could not enable maybe lip reading. So going forward, may I just say that the advent of COVID-19 pandemic has opened a new policy trajectory, towards inclusivity. We now know better, what society needs to do in order to be inclusive. Mm-hmm. For instance, the area of disability and disaster had not really had much in terms of investment by most of the actors and the stakeholders, at a national level in particular. And I think we have now, been awakened to the fact that there's quite some investments to be done in that area. Also, there's also the issue that those in charge of, information have also, to be vigilant that the process of leaving nobody behind, must be responsive to the peculiar information needs and requirements of persons with a number of, impairments. Particularly the issue of packaging and disseminating information during this COVID-19 into Braille, and sign language. you know, even the extent to which our billboards work, I think people have of late learned that those that have got mobility challenges, particularly using wheelchairs, have had challenges, you know, reading the billboards because of the positioning, you know, among other issues. So it's time for us to then rework, you know, and have some inclusive society, you know, premised upon, you know, participatory approaches to policy making, participatory approaches, you know, to development, as it were. That's my thinking.
Thank you
going
very
forward.
much. Thank you very much, Doc. Right now, we'll take a short break. We'll be back as we continue our discussion. Remember, this broadcast is brought to you by Zimpepes Television Network in partnership with the United Nations Development Programme, with technical support from the United Nations Partnership on the Rights of Persons with Disabilities. Thank you. Welcome back to this special program. My name is Munasham Kahlera. Remember, this program is brought to you by UNPD and UNPRPD. Today we are discussing how to build back better towards a disability-inclusive, sustainable and accessible post-COVID-19 world. Now, in our previous segment, we were just highlighting the challenges faced by persons with disabilities, the challenges they faced during the COVID-19 pandemic, the lockdown measures and so forth. And now, as we're still in the COVID-19 pandemic, we're just trying to map a way forward as to how persons with disabilities can be included more. And we just want to understand what they want. Now, going forward, as we move towards this desirable future, my first question is directed to you, Advocate Mateta. What can you say is a desirable future? What do you want to see in a post-COVID-19 world?
So, for me, there are two key things that I would consider if we want an inclusive post-COVID arrangement. So the first one is the existence of a proper legal and policy environment that supports persons with disabilities. There's already been mention of an expected disability bill. I'm afraid we have been talking about this bill for the past, for the past 5 years now, and I'm hopeful that we should quicken the pace of coming up with a comprehensive disability act. And then the second thing for me would be to put in place a comprehensive national disability policy. I'm also aware that there are efforts to come up with one, but I wish we could also quicken the pace. These two, to me, will set the tone, of course, for the second thing, which I want to mention, which is implementation. Once we have good policies, we need to also make sure that we implement them. And in order for us to implement them, we must make sure that disability becomes one of the key result areas for monitoring and evaluation of our national programming. So I think for me that would be the way going forward.
Thank you very much, Advocate. Senator Temire, as we discussed earlier, Advocate Mateta also highlighted how there was a disruption of livelihoods during the lockdown and so forth. Now, as we are moving towards a post-COVID-19 world, we're trying to see how this can be addressed. Of course, we're talking about policies, we're talking about legal frameworks, but what do you think should be done imminently for us to, you know, just figure it out before we have these approved? Because as we're saying, it's taking a bit of time, but at the moment now, what should be done? Senator? I think we might have lost the connection there for a bit.
Yes. I did not get your question.
Let me. Hello? Okay, that's fine. We might have lost the connection for a bit there. I'll bring it to you, Dr. Mthethwa. We highlighted that during the COVID-19 lockdown regulations, there was a lot of disruption of livelihoods. So now what we're saying is, what do you think can be done? Because of course, if we keep talking about legal framework and policies, it's taking a bit of time. What do you think are the possible things that can be done imminently? Your suggestions.
Thank you very much. I think 2 or 3 issues that people could look at urgently. COVID-19 has taught us a few good lessons, you know, about how we must do a few things, you know, particularly our intervention frameworks. First and foremost, it has taught us that we need to have you know, to change course when it comes to, you know, the planning and execution of our social security or social protection infrastructure. And probably in the same context, or in the context of you know, the current, you know, fiscal policy trajectory that was announced by, you know, the Minister of Finance, where, you know, those in informal sector need to be registered in order to pay some presumptive tax. We may take that, you know, process as well, and make sure that we are able to capture, by way of registration, a number of persons with disabilities, given that most of them survive by way of, you know, informal trade, like has been said. You know, they are, you know, active participants in that sector. So the issue of registration and database can be facilitated through the process that the Minister of Finance, you know, is planned by way of his fiscal policy. That's one. Secondly, pursuant to that, we also need to reorganize our social protection infrastructure so that it does not only rely on social assistance, but it also, you know, relies on social insurance, you know, for in the interest of sustainability. We have a constrained fiscal space as a nation, commensurate with our development, you know, in our level of development, but social insurance becomes more sustainable, and there should be a way of, you know, roping in the informal sector so that they contribute toward their own, you know, social security. I think going forward, that becomes more inclusive, that becomes more sustainable. Thank you.
Thank you very much, Doc. Natasha, we've heard the suggestions, but I want to ask you, as an advocate, when people, what suggestions do they also tell you? You said when people come, they say, we're facing this challenge, ABC, but then what would they say rather when we are in the informal sector, we're trying to be taxed, but at the same time, we are not in an official database. What are they saying? What do they want?
I think the first thing that they want is to be included, and as you said earlier, as Dr. Mthethwa said earlier on, the participatory approach, where people include the people with disabilities themselves to participate and contribute to whatever policies and laws that may be in the pipeline to being made, where they have their own voice and say what they need, so that we avoid a situation where we speak for people with disabilities and we make decisions for them when we do not really know what they need.
Thank you very much, Natasha. Let me try and connect to Senator again. Natasha just highlighted that people want to be included. They want to be a part of the decision making. Senator, to what extent can you say persons with disabilities are being heard in Zimbabwe? To what extent can we say... Oh, okay. Unfortunately, the Senator has just left the meeting. So I'll direct it to Soneni. I hope Soneni is still connected. Soneni? Oh dear. Technology is giving us a bit of a headache today. Yes, Senator?
Can you hear me? No, it's Soneni.
Oh, it's Soneni. Oh, perfect. I was saying, Natasha just highlighted that persons with disabilities also want to be included in policy making and decision making. We don't want to run a risk where we're now speaking for people when we haven't heard their voice. To what extent can you say we have certain people trying to understand the plight, and what would you suggest from that?
I'm going to put it as simple as this. Persons with disabilities are normal people who make decisions just like anyone else. So we shouldn't come to a point whereby when people are making decisions and then we exclude persons with disabilities from making their own decisions. As long as they're adults and they know what they want and they know how they want to run their lives, persons with disabilities are experts of themselves. No one can ever tell you how to live your life as a person with disabilities. So if able-bodied persons are making decisions for persons with disabilities, we will not go anywhere. That's why you will find out that in Zimbabwe at 2020, you still have persons with disabilities begging in the street. You still have persons with disabilities who do not know how to make their decisions. Is because we have people that make decisions for persons with disabilities. And when we say consult, we are saying meaningfully consult persons with disabilities, include them in every aspect of societal issues. So it mustn't be this is only for persons with disabilities. No, it should not happen that way. We are in 2020 and we expect everyone to be living their lives in a normal way. And it's not there, it's people with disabilities. For example, we're talking about COVID-19. The quarantine places, are they disability friendly? They are not. But we will not have this conversation. But we need to have these conversations and make sure that when we're talking about policies, policies are easy to talk about, but to implement policies, that's another issue. So it's time that as Zimbabweans, let's be serious about disability issues. If we are going to discuss disability issues, let's action them. It shouldn't take 20 years to action something. Right now, COVID-19 is right, it's back again on a second phase. You will find out that we still have buildings in Zimbabwe that are not disability friendly. So how do you expect someone with a disability to go to a hospital where they cannot get into a hospital because their steps and the stairs are not working, the lifts are not working? At the end of the day, we are all wasting our time as citizens. It's time that we need to be serious about human beings, and human rights matters.
Most definitely, most definitely.
That's my contribution.
Thank you very much, Soneni. I hope Ngobani is still connected.
Oh yes, I'm still around.
As a follow-up to the issues that were raised by Soneni, what do you think are the challenges that we will face? That of course we're currently facing a couple of challenges now, but what do you think are the challenges that we might face as we try to achieve this inclusivity altogether?
Oh yeah, that's a very huge, big question. But I'll start off from the very basic, which is the attitudes that are there about disability. You know, we have for a long time been seen as people who are not capable of making their own decisions, people that cannot think for themselves and all that all those kind of attitudes. So the first critical area will be to continue to raise awareness on disability so that we address those particular attitudes. And we have been, pushed to the margins also because of issues of inaccessible environment. So this is one of the biggest challenge that we have as persons with disabilities, as some the other speakers have also alluded to such issues. So, where persons with disabilities, even under COVID-19, have been failing to access a quality, affordable, and accessible healthcare. They've been failing to access education that has now largely been moved online, and such other barriers that we continue to experience at both physical and in the non-physical environment. Talk about transport and all these other issues. Mm-hmm. So in that light, I think there's need that we enhance comprehensive accessibility, and going forward, have it as a norm to follow principles of universal design when designing our products, our programs, our services, and so many other things that we do or as service providers and different stakeholders. And lastly, I think this point has been talked a lot about, which is a policy of our old, outdated policy framework on disability. So if we don't deal with those issues, we are obviously going to face so many challenges. But let me also throw in another critical one, which is the issue of data on disability, where currently evidence-based programming is somewhat impossible because as a country, we have failed for so many years. We are now counting like 40 years after independence, and yet we are still so behind when it comes to collecting data about disability. So right now, Zimbabwe is going to be going into a census, and at a global level, there are so many frameworks that are there which Zimbabwe can learn from as they design their tools for the census and as they carry out the census. So I'll point to frameworks such as the Washington Group of Questions, the disability model surveys, and also UNICEF did a module on collecting data for children with disabilities as well. So there are so many frameworks where Zimbabwe can learn from and ensure that in the forthcoming census that issues and concerns of persons with disabilities are also appropriately captured by that population census. So we can go on and on, but in brief, I think those are the issues that I can pick out.
Yes, as we continue with our discussion, we're having some feedback from our Facebook page. Rue has said this discussion completes the picture as we continue this discussion on disability and not inability. So this just brings to show how important this is for us to all just sit down and discuss and see how we can map the way forward. We're about to take a short break, but I'd like to just quickly ask Advocate Mateta just this one small question. We've heard what's the challenge, what we're trying to do, but what should be done and by who right now? Advocate, if you could just keep it as brief as possible.
So thank you. The first thing that I would advise viewers to think of when thinking of roles and responsibility in disability is that disability is not an individual tragedy. It's a national, it's a community issue. So everyone has a role to play. And then the second thing that I would also want to say is, you know, having said that, if you want to really deal with disability issues effectively, ngatiregerei kuita serious kunge vanhu vari kugerwa ndebvu. You know, we just need to take it easy. It's just part of us. Then the third thing, obviously, is I would advise the government to take a more proactive role, because government ndo yatakasiyira masimba edu ese tikati ini neuyu tava kupa masimba muchinhu chatinoti hurumende. So it should take a more leading role on disability. So that would be my brief response to that.
Thank you very much, Advocate. We'll now take a short break. Remember, this broadcast is brought to you by Zimpaper Television Network in partnership with UNDP and United Nations Development Programme, United Nations Partnership on the Rights of Persons with Disabilities. We'll be back shortly.
I don't know whether his chairman knows he runs at about 9 in the morning.
Yeah, I've just got the symptoms, so I just called the doctor and I just and then he just advised me to have to stay at home, eh?
Welcome back to this special program brought to you by the UNDP and the United Nations Partnership on the Rights of Persons with Disabilities. Now, today we were just discussing about trying to map a way forward post-COVID-19, a world that is inclusive, accessible, and sustainable. Now, as we continue with our conversation, the global pandemic has brought about several lessons. It's taught us a lot of lessons, and one lesson I want to zero in on is the technological aspect. It's taught us that we have to be technologically aware, but then at the same time, we want to understand how to leverage this to reimagine a world that is inclusive for persons with disabilities. I'd like to direct this question to Soneni. How do you think we can incorporate technology? We have highlighted that we had e-learning and it affected a lot of issues, and it also brings into play the aspect of money. But what can you say about technology, Soneni?
Hello.
Thank you so much for the question. I can hear you.
Okay, one.
Yes, Soneni?
Can you hear me?
Yes, I can hear you. Soneni? Soneni? Okay, Senator, we were just highlighting that technology has brought about a lot of lessons during this COVID-19 pandemic. So how can we leverage these lessons into incorporating an inclusive society for persons with disabilities? Unfortunately, technology is not really on our side today. Yes?
You can't hear me. Hello?
Now I can hear you.
Hello?
Now I can hear you.
Yeah, I think, okay. I think technology has taught us really a lot during COVID-19, because it has enabled us to communicate from wherever we are, to hold meetings wherever we are. But now we are also to understand that there are some people cannot access this. I can speak about those who are deaf. Whether we do Zoom, it needs someone to interpret to them. As well as speaking, yes, there is somebody who is interpreting, which means they can access that information. But at the end of the day, in some meetings or in some gatherings, you don't see people doing sign language. So technology, yes, but it should also put in mind that there are people with disability who also have to access all this. And at the end of the day, there are very few people with disability with these gadgets. And they out there in the remotest areas of the country, you don't find anyone with a smartphone who can go on Zoom, who can do meetings with someone from very far away, just because they cannot access these gadgets. And I think these gadgets should also be made cheaper, or for people with disability to access them. And also, when we talk about programming, I think now we have to program looking at these gadgets that they are a necessity to us, to everyone, that we have to communicate. This is the only way to communicate, and is a cheaper way also to hold meetings and conferences with these gadgets.
Thank you very much, Senator. Ngobani, hoping you're also still connected. Just if you could touch on the aspect of technology as well. You have told us that globally we have seen some innovations and so forth. What do you think as Zimbabwe we can learn from these, and how do you think we can incorporate it, as we highlighted that one of the major challenges, of course, is the aspect of accessibility and monetary wise? Ngobani?
Okay, thank you very much. Yes, can you hear me?
Yes.
Oh, okay. So how can we incorporate these technologies, translating to our day-to-day lives? I think Zoom. COVID-19 has taught us that people can work remotely. So, and yet, for instance, companies and other employers have not actually gone down to provide that reasonable accommodation for persons with disabilities to equally participate as productive employees. So that's one area where inequalities have been surfaced by this use of technology. We also know that people took their trade to online spaces, and yet this actually left persons with disabilities behind, where most persons with disabilities trading in the informal sector have not been able to utilize these online spaces and e-trading that that has been dominant throughout the COVID-19 period because of issues of restrictions on movement and other such controls that the government put in place. So also, when it comes to education, we've talked about how children with disabilities have not been accessing online education or e-learning. I think it's critical that going forward, that teachers must be capacitated to deal with the online learning needs of children with disabilities, so that education also includes children with disabilities, even when it is done online. So also, as Mateta earlier on noted, that issues of access to information are critical, but the information that we are seeing is inaccessible or coming in formats that are inaccessible for persons with disabilities. There should be a deliberate move by the government to ensure that information, be it on COVID-19 and other issues, is made accessible for persons with disabilities. And when we're talking of accessibility of information, there are so many aspects that we have to look at. For instance, persons with intellectual disabilities might need that information to be in what is termed easy read formats, and for persons who are blind and partially sighted, obviously need for braille, audio, and such formats, and obviously sign language for persons who are deaf.
Thank you very much, Ngobani.
There is a lot that we can do with technology, from trade to employment and economic participation of persons with disabilities, and in education and other areas of life as well. So those are the few issues that I can talk about.
Thank you. I'll just ask Saneni again, complementary to the suggestions that have been highlighted by Ngobani. In your view, Saneni, is this approach achievable in the Zimbabwe context?
Thank you so much. Can you hear me?
Yes, I can hear you.
Oh, good. Just adding to what Ngobani has said, in order for this to be possible, I think we need to look at the issue of data. Data in Zimbabwe is very expensive. And if you want to function in a normal way, which means that you have to have access to data, and most persons with disabilities are not financially stable to be able to be getting access to data and using data they want and how they want. And if we are looking at students with disabilities, if they want to do the assignments, their work, they need data, and not everyone can get access to data. And it's important that there should be a way that is made accessible, particular for persons with disabilities who have double or triple disabilities, in order for them to function in a normal way. Having a disability on its own is expensive, and having a COVID-19 being one of the greatest factors for one to function properly, getting information on COVID-19, how to protect yourself, you need to be in touch with the world and what is happening. So data needs to be very accessible for persons with disabilities. That's what I can contribute.
Thank you very much, Saneni. As we approach the end of our discussion, we've highlighted the challenges, we've highlighted what we would ideally want to see being in the future. But one thing to note is that building a post-pandemic future requires us to do what we could say, imagining the unthinkable. Now, putting this into context, I'll direct it to you, Dr. Mthethwa. What are some of the recommendations that you can make towards the post-COVID world that you desire?
Thank you very much. In brief, what we have learned during COVID-19, and the related pandemics and probably disasters, is that our institutional frameworks, have to be, made friendly to every bit and piece of the population. within the post-structural discourse, so to say, disability, like gender, thrives on representation, and riding on our constitution, a very powerful, constitution indeed, speaks to the doctrine of self-representation, which doctrine should be, now informing the way we craft our institutions, not only, as government, but also, in relation to other non-state actors. Persons with disabilities, must be part of the policy implementation framework. By that is meant they must be part of the officials and officers, that implement and even formulate policy. That should also apply, cut across the board, even in government and non-governmental organizations or agencies. For that to happen, government of Zimbabwe does not start from zero. I think this is what is more important. This country has had very responsible citizens who have bothered to educate persons with disabilities. So persons with disabilities are in no way short of skills to participate in every facet of life. We have lawyers, we have doctors, we have social workers, we have engineers, you name them, with disabilities. So my proposition is that within the context of substantive participation and representation, which is the trajectory that the country now needs to follow in the context of a post-COVID-19 inclusive society, let's talk about how persons with disabilities should be represented, at decision-making, levels, all levels of decision-making. And I think once we start, a meaningful, robust, and serious engagement on that path, starting off, like Advocate Mateta has said, with the government, to say in the structures of government, who speaks for disability? Because if wrong people speak for disability, then we are not going very far. I've always said last but not least that, I am a husband. I am a father of 2 daughters. But can I speak on behalf of women?
No.
If I can't speak on behalf of women, but I'm a husband for 20 years, I am a father, who then must speak for disability? Obviously, so in our policies, let's also make it mandatory for persons with disabilities to speak for themselves. For me, once we get to that level of civilization, as a nation, then we will get it right. Thank you very much.
Thank you very much, Doctor. Natasha, I'll bring it to you. The doctor has highlighted a very important aspect of representation. Soneni has also touched on the issue of how we also want people to understand that persons with disabilities have to speak for themselves and they have to be included. Addressing this issue, what would you recommend as we're going forward? Do we have enough representation? Do we have enough organizations and community societies? What's your recommendation going forward?
Thank you.
We're just about to close, so just keep it as brief as possible.
My recommendation would be that we have organizations mainstreaming disability in their programming through sensitizations in communities on disability rights. By this I mean that even our communities, like Mr. Mateta said earlier on, that is not a personal tragedy to have a disability, but it's a community issue where communities understand disabilities to an extent that they also respect and promote rights for persons with disabilities. For example, like when people are being given reasonable accommodation, then our communities also understand disability and also respect such rights.
Thank you very much, Natasha. And just to close, Advocate Mateta, given all these recommendations that we've had, the discussion we've had throughout this discussion, do you think it's achievable? And how long do you think it would take for us? Is it a matter of just sensitization? Is it a matter of representation? Is it a matter of inclusivity? What's your take on the matter?
I wish to say to the viewers, yesterday is not today, and tomorrow is not today as well. What this means is what COVID has brought upon us, not only here in Zimbabwe, is something that will stay with us for long. Our lives will now change and have now been changed. So I would encourage Zimbabweans to move out of our comfort zones. If we are saying technology has not been working well for persons with disabilities, the answer is not going back to yesterday. The answer is to make the technology work better. So is it achievable? Where there is a will, there is a way. But lastly, I want to challenge fellow compatriots with disabilities and just to say, you know, there are times when it becomes necessary just to tell each other the truth, to say it's not an excuse to plead oppression. If you think we are oppressed as persons with disabilities, of which we are, the world over, oppressed people have done something about their condition. So I would urge everyone, you know, to take up arms, not in the literal sense of guns and grenades, but to take up, you know, all they have emotionally, you know, academically, and all the other ways to correct the situation. Thank you so much.
Thank you very much, Advocate. Unfortunately, that's all the time we had for today. We had a very interesting discussion. Today's topic was in alignment with the International Day of Persons with Disabilities, in alignment with this year's theme. And the theme was Building Back Better towards a disability inclusive, sustainable and accessible post-COVID-19 world. I'd like to thank our guests for joining us. They had so much interesting input to give us, and we just do hope that going forward, we manage to address all of these challenges. Remember, this program was brought to you by Zimpaper Television Network in partnership with the United Nations Development Programme, with technical support from the United Nations Partnership on the Rights of Persons with Disabilities. That's all from me at the ZTN Studios. My name is Mnasha Mkahlera. Have a pleasant afternoon.